I am Dr. Garuda Rama, consultant pediatrician, Medicover Hospital. Today I am going to speak about deworming. So, about deworming, I'll tell what is deworming, what are the worms that infect the individuals, and what are the symptoms, and what is the consequences of infection of these worms. How do you prevent the worm infestation? What are the drugs that can be used? When will the deworming day is celebrated? So coming to the deworming, meaning of deworming. Deworming means we give some drugs which are called as anti-helminthic drugs that kill these worms and expel from the body. And what are the worms that commonly affect the individuals? They are all called as roundworms, hookworms, and pinworms. We acquire these worms by taking contaminated food or water, or from the soil. So if an individual if a child is playing with the soil, and if the soil is contaminated with these eggs of these worms, they enter into the nails of these children, and once they swallow these eggs into they will enter into the body, and they become adults in the intestine. And the disadvantage of these having worms in the body is they are called as parasites, means they nourish on the food that we have taken. So the child will become malnourished, and the physical and mental health will be affected. So the child will be malnourished, and there will be failure to thrive, and the child will become anemic. And because of mental health, the child may not able to concentrate in the schools, and the school performance will be decreased. Because the child will be malnourished, their resistance to infections will be decreased. They are more prone for infections. So this will be a vicious cycle. So by giving these anti-helminthic drugs, we can stop this, and the physical and mental health will be better. So now, once an individual will get the infection, what will be the symptoms the child can have? Because these will infest in the intestines, the child can have abdominal pain, and the child can have vomitings. Sometimes they can have even loose motions or blood in the stools, and the blood in the stools mostly occurs with the pinworms. The most common is they have a loss of appetite, loss of weight, they'll be anemic, and the growth will be affected, so they will be stunted, and the school performance will be decreased. And these worms, sometimes they produce some substances, they will be allergic, so they can have a skin rash. And mostly with the pinworms, the adult worms, they at the time of night, they will come out of the rectum and they lay eggs. So they cause perianal irritation. And sometimes these worms can migrate up to the vagina, they can cause vaginitis and urinary tract infections. So these are the commonest symptoms like loss of appetite, loss of weight, abdominal pain, growth stunting, decreased school performance, repeated infections, skin rashes, and perianal rash, vaginitis, and urinary infections. And so what are the advantages of giving these anti-helminthic drugs? So by giving anti-helminthic drugs, these worms will be killed and they will be expelled. So the nutrition will be better. So the child will grow faster, and the height also will be normal, and the child can concentrate in the schools, and the school performance will be good, and the infection rate will be decreased. These are the advantages by giving these. So every child should take anti-helminthic drugs once in 6 months. And how do you prevent these worm infestations? So as I told you, these are acquired from the contaminated soil and contaminated food and water. So by taking these measures, we can prevent it. Like while walking, we should wear slippers and shoes. We should not go on barefoot. And you have to maintain the personal hygiene. Like before taking food, you have to wash hands, and the nails should be clean and it should be short. And before taking food, one has to wash hands, and after toilet also one has to wash hands, because these eggs are passed in the stool. So if there are eggs in the stool, and they can be carried in the hands, and if they put the hands in the mouth, and they are reinfected. So the washing of hands before taking food and after toilet is very important. And instead of defecating in the outside, sanitary latrines should be followed. By this also we can prevent it. And cooking food and taking fresh food also prevents this infection. And washing vegetables and fruits before taking also will prevent these infections. So when once, if they maintain the personal hygiene, you can prevent these worm infestations. Thereby the child will be healthy. Now coming to this, what are the drugs used and what age we will start these drugs and how frequently these drugs to be given. So the common drugs that are given to prevent worm infestations are mebendazole, albendazole and pyrantel pomade. The common drug that is given routinely is albendazole. So this albendazole can be given from children from 1 to 19 years. So children aged more than 2 years up to 19 years, we give 400 mg only once daily, once only. Whereas in children less than 2 years, it is given 200 mg. And how frequently this drug should be given? It is given twice in a year, that is once in 6 months. So these adult worms to mature in the intestine, it will take this time. So by taking once in 6 months, we can eradicate this worm infestation. Thereby the child will be healthy and it can prevent the infection rate. So this is for this reason, the Government of India launched that National Deworming Day on February 10th. On February 10th, in all government schools, all children aged from 1 to 19 years are given these anti-epileptic drugs by teachers and Anganwadi workers. And the common drug that is given, as I already told you, the albendazole is given at a dose of 400 mg if the child is more than 2 years of age. So normally they give once in a year, but if in endemic area where the infestation rate is more than 20%, they give twice in a year. So this is regarding the deworming. This is by giving these drugs, the side effects are very minimal. So they are very safe. So every child from 2 to 19 years should take this drug albendazole 400 mg once in 6 months. Thank you.